Hi, Steve from Arana Physiotherapy. Today I thought we'd start off by having a little look at your neck, or just neck anatomy. And then following up the rest of the week then we're going to start looking at some treatment techniques for necks and headaches and what you can do to get better and to give you the good news about treatment for neck pain. So the reason I thought I'd chat to you about this today was we see quite a lot of this. An awful lot of the new clients coming to see us, there's a high percentage coming with neck or back pain. And it's quite good to just sort of dispel some of the myths around necks and backs, so I thought we'd start with that today. So here's a neck, one that I prepared earlier. So it's comprised of 7 vertebrae, 1, 2, 3, 4, 5, 6, 7. And it sits on top of your thoracic spine, which is the part of your spine that your rib cage comes off. Now, sometimes the best way to think about this is I tend to divide the neck into 2 components. So you have your upper neck, which comprises of the third, the second and the first vertebra, and then your head that sits on top, your skull. So if you think about that, that's one part, your upper cervical spine, and then from 4, 5, 6 and 7, we look at that as your lower cervical spine. Now, if I can put this in a little bit closer, what you'll see, that's your facet joints. You've got facet joints in between each of the vertebrae, and what they do is they allow for a degree of motion to lift your head back, to bend your head forwards, and also rotation. So they're sort of like a bit of a guiding, they determine how far we can move. Sitting in the middle here, just like your lumbar spine, is the disc. So your discs are like the shock absorbers in your neck, and they also allow for greater range of motion. And then coming out the side, these yellow sort of bits of spaghetti, if you like, coming out the side, those are your nerve roots that come out of a little sort of gap or foramen that's made between the upper and the lower cervical vertebra. Now, from a pain referral point of view, your upper cervical spine is quite important, because when your upper cervical spine, if it's causing a problem, you tend to get pain at the back of your head, coming around through at the front, even behind your eye. And that's where typically a lot of our headaches will come from. If it's coming from lower, so from about C4, C5, we'll tend to find the pain is more coming down the neck and over the shoulder blade. And that's quite often people come in and chat to us about having shoulder pain, but when you're finding your pains coming up around about this area, it actually tends to be coming more off your neck. And then further down you go, the further the pain travels. So around about C6, C7, then we're starting to talk about pain that can come down the arm and into the hand. And that tends to be more of the nerve type related pain that we talked about a few weeks ago. So the next thing with your neck is what you've got to look at is, you can obviously see this is quite a lot of little joints and going on in here. So it's obviously a part of our body that's made to move quite a bit. And we've got to be able to turn our head and move it so that we can see things that are coming, so we can, if there's a noise to one side of us, we can turn our head so we can sort of just lock into those noises. So it's a really important component. To do that, it's got to have quite a clever muscle system. So the best way to think about it is you've got 2 sleeves of muscles. You've got an inner sleeve, which you could consider to be like your core of your neck, and then you've got an outer sleeve, which are like your big movement muscles. Now we do know that this inner sleeve gets weak, that can lead to some problems for us, and it's certainly specific to people that have got headaches, maybe some long-standing neck pain, and especially those that have been maybe involved in car accidents in the past. And then we've got the bigger muscles that we can see in the outside, so you can sort of obviously see this big long one coming down the front of your neck, that's your sternocleidomastoid, like the trapezius that comes off the side and then goes on the top of the shoulder blades, and these muscles then attach onto your scapula and onto your thoracic spine. So they're your big power ones, so they're going to really control, or they make you move, they sort of force you to move. So from that point of view, you've got to look at 2 muscle systems. So we're going to look at this sort of controlling or stabilizing deep system and your big sort of powerful strength system on top. And both of these areas can be problematic in neck pain. So how do you know if you've got a muscle problem or if you've got a stiffness in your neck? And that gives the game away, because we try and divide our necks when people come in into sort of 3 categories. Are they weak and painful? Are they stiff and painful? Or are they a combination of both? And a couple of wee ways to go and demonstrate to find out is, quite often people come in and go, if I put my hand on my neck there and I move it and that takes the pain away, and I do a few of those, and I'm much better, and that stays better for a while afterwards, that might indicate that when you're pressing in there, you're sort of self-mobilizing that neck and it's feeling a bit nicer. So you might be more of a stiff and painful neck. Other people might go, yeah, when I've got, when I hold my neck and then I move it, and it might be lifting my head back or turning my head left and right. It feels better at the time, but when I take my hands away, that pain comes back, and that might indicate you've got more of a weak and painful neck. Other wee tricks that we tend to find is like if we can give people, if they sit like that and they turn their head left and that makes it sore, lift the chest up, maybe shrug the shoulders, change the position, and if that gives them more movement and less pain, then there's a postural element to it, and if there's a postural element, that tends to make them sort of a bit weak and painful. So I'll let you think about that today. I'll put up another post about some anatomy. Tomorrow we will look at some muscle function tests and some exercises for neck pain, and we'll start having a wee chat about headaches as well. And later on the week we'll look at ways you can self-mobilize your neck if you're one of these people that are stiff and painful. Anyway, enjoy the rest of the day and I'll speak to you later on. Bye bye.